wanted to kind of give a quick hits on the things that we've been up to this past week. You heard from the governor yesterday about some of the metrics that we'll be looking at as a Commonwealth to continue this march towards a phased reopening around decreasing percent positivity, hospitalizations, bed capacity, particularly ventilator bed capacity, as well as increasing the supply of personal protective equipment, and then testing and contact tracing. So much of our work as a local health department has been invested in those last two, the testing and contact tracing functions. And I think that, as we head towards, May 15th, if that's indeed when we decide to, as a Commonwealth, to move into phase one, there will be a lot of requests for guidance from businesses, from nonprofits, from many partners about how do we do this safely. And we've already received a handful of those requests as a health department. We're helping to review some of those plans. And for reasons I don't fully understand, the CDC was on schedule to provide a bunch of very specific guidance for churches and summer camps and schools and other types of entities that will move towards opening in the months to come. But that has been delayed, as I understand today. So we will use our best expertise as a local health department, but much of the sort of high-level expertise that would come from the CDC, we may have a delay on to be able to apply that lens to the opening plans of some of our partners here locally. Here's what we've been doing with testing. Yesterday at Nottingham Green was our 6th community testing event. As the mayor mentioned, we've got 3 coming up next week. I want to express my gratitude to all of the host sites. It's a heavy lift, certainly for our staff and our volunteers who have come out, but it's also an act of generosity of the host sites, whether that's a housing community like RRHA or a neighborhood, a privately owned neighborhood like Nottingham Green or Southwood. But I really appreciate the partnership of those different communities in standing up these testing events and helping get the word out about these testing events. I also want to particularly thank the Richmond Fire Department, because as we prepare for our testing event in the East End next week, the fire department will be on the ground in communities handing out masks and hand sanitizer and information about the upcoming testing events. And so really appreciate their efforts to get the word out. And then you heard yesterday from the governor about the National Guard's presence throughout the Commonwealth, and that presence has been particularly felt in a very positive way here in the city of Richmond. The National Guard has been extraordinarily helpful to us as we have performed what we call point prevalence surveys, so mass testing in long-term care facilities. And then they were also helpful in the event we did in Henrico yesterday. They did the tent setup and breakdown in Nottingham Green. We would love to explore other ways that the National Guard can be helpful to us as we expect to continue doing community testing events over the next few weeks. And I think part of our conversation, an ongoing conversation with our communities, is helping them understand who the National Guard is, what role they play, and how they're coming along in service. We do want to be sensitive that there are communities across our city and county that may be a little bit hesitant or maybe concerned about the presence of folks showing up in military-style Jeeps or in fatigues. And so there's some work that we've got to do on the front end to help our communities understand who the National Guard is and what role they're playing, and to ensure that that's not a deterrent to people to come out for testing. But we've been very grateful for the presence of the National Guard, and we'll look for other opportunities to deploy them in our work. Contact tracing has also been a huge part of our focus. As I mentioned last week, we continue to build our capacity. This week alone, we've trained 70 new Medical Reserve Corps volunteers to do contact tracing, and they will start next week in actually doing that work alongside with our committed staff. The state continues to take steps forward in their plans to hire approximately 1,000 contact tracers across the Commonwealth. I do see that this volunteer pipeline for now may actually serve as a way to funnel people into paid work. Yesterday, one of the things I think the mayor has done a fantastic job is engaging representatives of some of our underrepresented communities and seeking their input about how do we message in these communities, how do we get the word out, how do we really impact behavior. And yesterday on one of those calls, a member of our African immigrant community made a really insightful statement about the importance of hearing from people who know and understand and are a part of your community. And I think that is particularly applicable to our work in contact tracing. And so my encouragement and plea to residents of our community across the city and the county is that as the state moves to start hiring individuals to aid in contact tracing, that those of you who are from different cultures or speak different languages are going to be particularly helpful in doing some of that effective investigative work. And so I really want to encourage you to come out and to be either through the volunteer pathway now or to be hired in those roles as contact tracers. And we should have more information on that in the next couple of weeks. And then the last, we've talked a lot over the last 7 weeks about long-term care facilities and the fact that they have been, in many ways, the focus of these outbreaks. That continues to be the case. Much of our work is supporting the staff and the residents of long-term care facilities. I've also gotten many inquiries from the public and from the media about case reporting, and I've shared that VDH's policy has been that we're not allowed to share that information without the permission of the facility. A few weeks ago, the Centers for Medicare and Medicaid at the federal level, CMS, issued a statement that they wanted to require all regulated facilities to share information about cases and deaths publicly. And so it's taken a couple of weeks to work out what those details will look like. I expect that the rulemaking at the federal level will be completed this Friday, and likely May 17th, we should see public reporting on that information for nursing homes and assisted living nursing homes that are regulated by CMS. Okay, that's all I've got. Thanks.
Thank you, Dr. Avula, and thank you for your work. And as I stated before, Dr. Avula's remarks, we are still urging anyone, if you have any symptoms, to please show up at one of the testing sites next week, and I'll just go about repeating them one more time. It's Monday at the community supermarket in the East End. On Tuesday, they'll be at Southwood Apartments in South Richmond, and on Thursday at the Eastern Henrico Rec Center. We are begging, if you have any of those, and you have any symptoms, please attend.
Monday, one again, I'm sorry, I missed the name of the supermarket.
For you, Cam, we can repeat. Monday, the community supermarket on the East End. Also, I want to just add some remarks to, we know that the governor has been talking about a phase reopening, and he stated that this phase reopening is a floor, not the ceiling. And I have stated many times from this podium and beyond that I believe any approach to reopening should be slow and steady. We should take a cautious approach to this. We all know eventually that our economy, our city, all these entities and institutions will reopen at some point. But we must stress it's about how we reopen. How we reopen. We've seen a number of images all across this country of people celebrating spring breaks out on beaches, people gathering and congregating in large fashions in parks. I'm stating in the city of Richmond, we will take a slow approach to reopening. That is the approach I think is prudent because of public health. Obviously, you always will have to weigh the economic recovery alongside public health, but I truly believe that the life is more valuable than the dollar. And I will also say that you cannot, I know folks want to return to their livelihoods, and obviously I want folks to be able to